Welcome, everybody. This is Emily Sanchez, the divorce coach, and today I have a very special guest, Dr. Richard Burton. I'm so happy you're here. I really have been looking forward to this, and I know a lot of people are looking forward to you answering some questions. So I'll get right into it, but I wanted to introduce you just a little bit. You are a psychiatrist.
Yes.
One of my friends, raising 6 boys who are amazing musicians, and we love the Burtons, and I've always respected Dr. Burton and his views, and I think that he helps so many people and is doing so much good. So I wanted...
Well, thank you.
You're welcome. He's been in practice for 10 years. He's at Redemption Psychiatry, and he's gone to USC Medical School, so I'm excited to hear what you have to say today.
Well, I'm happy to be here today.
Well, I am glad that you're here.
Yeah, it's a fun opportunity.
Good. Well, we'll just get right into it. I have some very personal questions, actually, from some people that I coach. And the first one, and it's been one that my child has asked, especially when she was a little bit younger. But the question always comes is, why did you get divorced? And a lot of people really hesitate or they tiptoe on this because it gives the parent anxiety and a lot of times a lot more worry than it has to. And so just as a general rule, what would you say to that question? Why did you get divorced?
So it's a good question. How do you address that? I think the most important thing is to be frank and open with your children. I think a lot of times we have fear, and maybe it comes from, I think a lot of our parents in the prior generation, it was, we don't talk about problems. But I think it can be very valuable thing to talk to children about what is going on. I think it's important that they start to understand at a very early age, and I think we speak to their level. I don't think we tiptoe around or pretend like something's not happening. It's important to say what is happening, but at their level. So you don't give a ton of details. If there's a problem with alcohol or if there's a problem with pornography or something like that, I don't think you give details, but you might say we're having difficulties talking to each other, or we just don't get along as much as we used to. And I think those are things that children can understand. They experience it on the playground. They experience it in school or at church. And I think in bringing it down to their level, you're giving them a couple of gifts. One is you're helping them to understand the process, but you're also helping them to deal with their own challenges in life. And when they see mommy or daddy struggling with something, and this is how mommy and daddy deals with it, it teaches them that when they have problems in life, they can get through it. So, there is a side to the challenge of getting divorced or separated that can be a gift for your children if you talk about it in a healthy way.
Wonderful. I always love to see the positives out of what, so many feel is a negative situation. But I'm going to get really specific a little bit. So let's give you a scenario. Let's say that the father has cheated on the mother various times. And there is a 13-year-old girl who has a sense, maybe, of what's going on. As the mother, would you say, your father has betrayed my trust? Would you kind of pinpoint it on everyone makes choices? Your father has chosen. Or does that create kind of a separation between child and parent? What would you suggest?
So, again, it's really challenging. These situations are always really difficult. If trust has been betrayed, I don't think you lie about it. But I think it's really important to, at the same time, not alienate the other parent. The problem with just focusing on the betrayal is that you are creating this unspoken message that people can't be trusted, or the institution of marriage is just not something that is possible in a healthy way. And so I think it's important. Yes, I think you can still talk about it specifically and say, Daddy did something it made me not trust him in some ways. And I don't know how extensive the betrayal is, or the things that he may have done to create mistrust. There may be extreme cases where it may not be healthy, especially if someone has done something that is illegal and, may end up, it's something where they could end up in jail. But I would say that probably in most cases of divorce, even when there's been betrayal, it probably doesn't warrant complete alienation from another parent. And, the concern there is, again, that message that you're sending. You may think that and perhaps you have your own anger that you're also acting out on, that may be coming across as well. There's kind of this revenge about all this betrayal that you've had to suffer, which isn't fair. But be careful about how that message comes across, because it may sully your child's way of dealing with people in the future in general, in relationships. And I don't think that's something that you'd want to leave with your child. To go a step further on this, I think one of the things that I see a lot in psychiatry in my relationships, and I'll make an analogy here for a moment, is a lot of people that I see for various reasons have experienced this phenomenon that when a relationship breaks down, you can never fix it. And one of the most powerful things that I have seen in clinical practice is working with people and having the experience where, maybe I do something as a psychiatrist to fail one of my patients, but then we repair the relationship. And that repair, that mending, can be really powerful. And I think that's something to keep in mind here, that, you may have a spouse that has betrayed you, and it's painful, and it's not okay. But it's possible also to repair that relationship. It doesn't mean that necessarily you don't get divorced, or that you, get back together with someone who's unhealthy, but you might mend the relationship in a way that is healthy in a different way. Perhaps, they finally do their work 10 years later down the road, and you can have a cordial relationship. And I think that can be very healing. Not only for yourself, but to see your children model that to your children, that you can repair relationships, is a huge gift. Because we are going to encounter in our life all kinds of people at work, at church, at school, people who betray us or offend us, and obviously not as deeply as you might be hurt in divorce, but it's something that I think is really important to learn how to find that healing, that repair with people.
Absolutely. And it's something too that I always, say on my podcasts and with my clients, is how important it is to respect their parent, their other parent. And you have to know your audience. That's someone they love. And so to respect them and to get into a working relationship is just huge for the child. But going along back to maybe there is that kind of a disparage there. I have a client whose daughter senses that it has been the betrayal. And now she won't talk to her dad.
Mm-hmm.
And what do you do in that situation of trying to repair that relationship?
It's difficult. It's very difficult. But again, I think it's those same principles of, I think there's going to be a challenge of the mother in that situation being able to overcome her own challenges. I do feel like the role of a mother and a father in parenting and growing up is really important. It's a very important part of development. There are things that a mother can bring that a father cannot, and vice versa.
Mm-hmm.
And when that happens, I think it could be very easy to just buy into, well, okay, I'm not making her feel resentful towards her father. She's doing it all on her own, and then you feel justified and I'm just supporting her in that stance. The problem with that is it may be just a temporary thing where she's going through her own grieving process.
Right.
And it might not be something that would normally be sustained unless it's nurtured. And I don't know that that's something that should be nurtured. So, does that make sense?
It does. So what you're saying is whether it's a personal grief of the daughter that she sees her dad has done something to hurt the mom, she has to go through that process, and then to evaluate if you are feeding into that,
right, to
maybe harbor that grief even longer.
Right.
So knowing when that time is, and I think this particular mother is so good with separating her own betrayal, wanting the relationship to be great between the dad and her daughter. And so I think just being cognizant of her own daughter's grieving process, but that's a really good point. And then being careful to not enter in and possibly feed upon that, but to nurture a good relationship between daughter and dad.
And I think something that can be very helpful in that situation is to really validate what that young woman is going through. To validate, what, you're angry with your father, it's okay to be angry. That's very natural based on what happened, and she could see him as being the cause of all the family breakup, and maybe he was kind of that seed, and I think it's good to process that, and maybe that is the opening, not necessarily to say you need to have a relationship with your father, but maybe starting with, why don't you want to have a relationship with your father? What's going on here? Is there a magical, you could even introduce the idea of, is there this magical idea of what would you wish your life had been like? Okay. And this is what your life is now. And then maybe comparing, well, are there any things in your imaginary life that you could still have?
Yes.
And how could we make that possible?
Yes. That's really good. Good. My next question is just kind of more general.
Okay.
So a lot of kids, they're hurting, just as that daughter. They're hurting. They're not really understanding. They're going through whatever they're going through with their own grief. You're ruining my life is a phrase that I've heard many times. And what are some of those warning signs that maybe you're freshly divorced and you're seeing your kids grieve? What are some warning signs to pay attention to?
Warning signs of
that the kids are exhibiting that the parent may need to take action. So one thing I can think of is maybe their grades start to slip. What are some other just general warning signs that?
I mean, you might see, some of the warning signs that you might even see with that they say to watch out for. So substance abuse, grades dropping, withdrawing more, outbursts, anger outbursts. erratic behaviors, things that are maybe not typical for that child. Okay. So maybe just, you might call it personality changes. Mm-hmm. Just behaviors of, why are they doing this? This is not my child. Mm-hmm. Those would all be signs, I think.
Good. Yeah. Hopefully it would be easy for the parent to see that. So just abnormal things that your child usually does not exhibit would be the signal for you to take action. Yeah. So how do parents, if they were to see that warning sign, how could they nip it in the bud from the beginning? They first see a warning sign. What do you do?
Well, I think the first thing that a parent does is you don't wait for the warning sign.
Oh, I see.
Right?
Yes.
So I think you start with
I like that.
talking to them and, maybe not waiting for some of those things to happen. But, maybe it's because it's so chaotic for yourself mm-hmm. and, you're not able to catch it before that time. Or maybe you do talk to your child and you're still seeing behaviors, which can happen as well. I think at that point, you first start to engage your child. And it might depend on how, psychologically savvy you are. But I think that's the first step, mm-hmm. is just trying to engage them more and talking to them about their behaviors. Mm-hmm. I don't know that I would focus on the behavior itself, but I think I would always see the behavior as a symptom. You don't treat symptoms, you treat the cause of the symptom. Mm-hmm. You don't treat a bullet wound just by stopping bleeding. You remove the bullet,
yes.
You get to the source. And so when you see, the child is teasing their sibling or yelling at you, those are concerning behaviors and not acceptable. But I don't think you focus on that behavior. I think you focus on, wow, you've seemed really upset lately. Is there something else behind this? And, mm-hmm. and maybe see what their insight is behind it. Mm-hmm. And I don't know that I would either make assumptions either. I mean, you can maybe suggest some things if your child, it doesn't seem completely intuitive about what is going on or they don't want to talk about it. And, there might be a point where you just feel like you're not connecting. And I think at that mm-hmm. point, mm-hmm. It might be time to seek professional help, mm-hmm. whether it, maybe start with therapy or, the other thing that can happen with mental illness, if there's a family history of mental illness, or maybe there's not a family history, but sometimes depression or anxiety disorders can be triggered by intense amount of stress. And so, right. a child that may not normally have depression, they're completely normal, never had any problems, and now all of a sudden your child is acting depressed, and like, no, it's just because of the situation. Well, it still could be depression. Mm-hmm. And that's where, I think it would be wise to seek out a psychiatric evaluation and have a professional determine that mm-hmm. if there's signs of that, of withdrawing, difficulty concentrating in school, irritability, kind of feeling hopeless, or mm-hmm. even suicidal thoughts, mm-hmm. Changes in diet, how they're eating, their energy level, if they're sleeping more, or just not engaging in activities. Those are all signs of depression, and could warrant medication mm-hmm. potentially. Treatment with depression doesn't always mean medication, but if there is depression and you don't want to pursue medication, I would at least pursue therapy. Right. Now, I think you already answered my next question, okay. which was for the more serious issues. Mm-hmm. But what if somebody is saying, what's your answer for, well, we don't have resources, we don't have that much money. What do you say to people that just say, there's no way I can do therapy? Mm-hmm. As a psychiatrist, I'm a doctor, I prescribe medications. That's most of what I do. I do a bit of therapy, but a lot of what I do is prescribe medications. And that being said, I'm a very big advocate of therapy. I think it is something that can change people more than medication can. And even studies have shown that a lot of depression studies have shown that people who take antidepressants and get a response and then stop, 80% of the people within about 6 months will relapse back into depression. People who do therapy to address their depression, therapy only to address depression, and then finish therapy, have about a 20% relapse rate at about a year. So, in other words, therapy is much more sustainable once the treatment has ended. And that being said, what is the magic of therapy? Well, the magic of therapy, I think, is that people learn how to cope better. And that it's an unspoken, it's a non-visible skill or asset that I think a lot of people don't appreciate. When we see normal people walking around, we don't really appreciate healthy behaviors. And, I think a lot of things that we are willing to pay for, we're willing to pay for things that are tangible. We're willing to pay for, psychiatrists to prescribe a medication because now I'm taking a pill and I can see this, and it's almost this tangible thing that is helping me. Where therapy doesn't feel so tangible. But I think it has the same kind of merit that getting an education does. An education can be very expensive. A decent education just at a community college can cost thousands of dollars. And if you think about it in that way, I think that therapy is an investment. And it's, if you think of someone trying to get through life without an education, I'm not saying that isn't possible, but people have a better chance of being successful with, a college degree, for example. And I think the same way, the longer someone is suffering and not getting help for distorted thinking, sometimes it can become more ingrained. And especially in those formative years, when a child, should be, hopefully socializing and learning how to interact with people, and now in this crucial point in time, now they're withdrawn and disconnected from people. They're missing out a very important part of life of learning how to connect with people. And so to wait and see when, we have enough money, it's one strategy. It's concerning to me, though, that because you don't want to, if someone breaks a leg and you just, we're not going to go to the doctor until we have enough money, they could have a limp the rest of their life if that bone heals crooked. We don't see the brain healing crooked, though. And so we think, well, that's not a big deal. It can be fixed. And it can, but it can be harder the longer it's not addressed.
Well, my family member recently told this to me, when she was talking to her daughter. She said, if you had cancer, we would give you chemotherapy. Because it's growing. It's getting worse. So you have to look at it like that. And not maybe what society thinks. But I think society is coming around at knowing that
it is. Yeah.
And so, I really appreciate that. So parents, if you feel there is an issue, exhaust resources and let's nip it in the bud now. So,
and just, a quick thought on that is, it can be a challenge with the financial resources, but I think, look for other places where you can get support from, church can be supportive sometimes, or even family members. If you, advocate for this, like, this is really important, we can't afford it, could you help us out, or even lend us money? So I think there are ways that if you really are, invested in making this happen, you can make it happen and not delay.
Ways of being resourceful.
Sure.
Yes. So I'm going to take a turn a little bit. This is not a good segue at all. But a question I have now, sometimes we make the mistake of venting about our ex or the situation in front of our children, what are the effects when the children hear a parent venting about the other parent in the situation?
Yeah.
We touched on it a little bit.
We did.
Earlier, but...
and, you know, the specific effects may depend on how old the child is. And, you know, to really look at this in detail, I think you'd want to look at child development and where a child is in development. You know, one thing that comes to mind is until the age of 10 years old, children have a very concrete way of thinking. They also have a very, in other words, they don't abstract. They're not able to understand things like good and bad, and there's something in the middle. Like some people do bad things that they might be a good person. That's a really difficult concept for a under age 12 child to understand. And there's also a lot of magical thinking. So it's very normal for a child under the age of 10 to still be, infatuated with flying or magical powers or being a fairy or something like that. So, and those, that's not abnormal at all. But tied into that is the whole concept of, so now you have the 7-year-old and mommy just said, daddy, who, maybe this child has thought up to this point is just, he's king of the world.
Superhero.
He's a superhero. And daddy's a horrible person.
Yeah.
So now daddy falls from grace to, he's like the devil now. Like, there's no in between a lot of times with little children. It's black and white. And so that can be really hard for a child. Now, so I guess the next question is, what do you do if you do that? It's, you can't unsay it now, right?
Right.
And I think this is the part where you again go back to what I talked about before. You try to have a fair conversation. And maybe that's where you also model your own frailties. I was upset.
Made a mistake.
I shouldn't have said it like that. And I don't think that you lie about it either. But most likely, if it's the way you're describing it, where you let something slip because of anger, there's probably a little bit of hyperbole in that statement when you slipped. I don't know. Is that possibly fair to say?
I think so.
Okay. And I think you just come back to saying what is truth, but maybe also looking at both sides. I think a lot of times we are so focused on what is negative that has happened that we are really blind to what is positive. And I'll give you an example. I was just seeing a patient yesterday who has had some traumatic things happen to her, and a lot of it was at work. And she has a lot of fear of going back to work now because of these negative things that have happened to her. But she's so focused on all the bad things that can happen that she's until we talked, and hopefully I helped her to see a little bit more, completely blind to all the positives. So, and I give the analogy to her of, if I were to present someone with, hey, I have this medication, it could help you, but just by the way, it could cause, constipation or headaches or shakes, or you might not sleep, and, potentially you could even become suicidal and kill yourself. And that's the medication. There you go. Will you take it? They're not going to take it. Nobody's going to take it for that. Now, it's not that I won't tell people what the side effects are, but I'm going to say, the chances of this happening are pretty small. Here are the percentages. Suicide, less than 0.1%. Most people that have some of these other side effects, it goes away. And 85% of people that take this medication, or whatever, 60% of people feel better. So now I'm opening up, here are all the positive sides. People are going to be more likely to want to take it. And I think that's the danger in divorce and in all this, in viewing this, is a lot of times we're so focused on the negative. We don't focus on anything positive that has happened. And there, I would argue that you can find things that maybe it's hard. Sometimes it can be hard. But maybe there's when you were with Dad. I know it was only 2 times a year. But remember that time he was there for your birthday party and you were just so happy.
Right.
So there were times, I know Dad wasn't there a lot of the time, but he tried when he was there, even though it wasn't as much as you would have wanted it to be. But finding those things, again, I think that helps to have faith and hope in humanity and relationships.
So if you do make the mistake
right. of
venting, you need to stop yourself, admit you're human, and say, hey, remember that time when your dad did this? Remember that time when this and that? We can always reframe. We can always find the positive.
Reframing, right, balancing the positive with the negative.
Yeah.
And teaching some of that gray. Helping to teach that there's not just black and white.
Good. So going back a little bit where we were talking about therapy and the parents really trying to be resourceful, that if that is a need and something that they see in their child to get done. Now, what if I have a client, this is the scenario, with an older teenage boy, and he, I believe, is suicidal. He is showing huge signs of depression, obviously, and is completely refusing help from church leaders and therapy in general. So, I always want to be the person that forces, and I have that type A personality where I can envision myself, in their room and bringing a therapist to them or whatever. But what do you do in that situation?
So I think there are different degrees, and what you're describing to me sounds more of an extreme degree where there's great concern. We can start why don't we start at the lighter end first, and we'll go to more serious. So on the lighter side, I think it's important to really just try to improve your parenting skills or re-implement or implement those things that are just natural consequences. So as an example, I think having appropriate use of cell phone and computers, limiting those in an appropriate way, those are things that I think can be just natural consequences. When a child is starting to withdraw, I think that's a natural tendency for most people when they're dealing with something stressful is to not want to deal with it. I think that's why there's something called happy hour.
Yes.
Because so many people want to escape. It's just a natural thing that I think people are drawn to. But if it's done in extreme, it can become unhealthy and potentially develop an unhealthy pattern that might be hard to break. And so, having normal rules for the house, being able to earn computer time, being able to pay for your own phone in some way, whether it's by having your own job to pay for the phone or having some kind of household chores. And if those are not followed through, then consequence is no computer or no phone. The same way that, and I think a lot of times parents have difficulty implementing that because they think, well, I'm just being mean and my child tells me I'm being mean. But if you don't pay your AT&T bill and you tell them, well, hey, I'm sorry I was late, but I'll pay you next month, I promise. AT&T is going to cut off your cell phone. They're not going to say, oh, okay, well, we'll let you go this time. No. And I think that's the way the real world is. So I don't think it's being mean in implementing those consequences. It's teaching them what the real world is like so that they're more ready to deal with it.
So basically, life keeps going.
Life keeps going.
And sometimes we feel, I say we, because I was, a divorced person with a daughter, divorced parents, they feel like they have to tiptoe. My child is suffering right now. Or maybe if they're not even suffering, they'll say, well, I don't want to upset them.
Right.
So I'm going to allow this or that. But this has to be a time where your routine is strict. Your parenting is just as strict as it was before. So they see continuity and can feel security and know accountability.
Right.
So let's move to more of an extreme case.
Well, and on that same note, chances are, as the parent who's getting divorced, you still have to do your responsibilities. You still have to be a parent. If you're working, you still have to earn the money. You still have to pay the rent. Life doesn't stop for you either. And that's hard, but it's something you just have to get through. You have to keep on with life.
Right.
And I think you have the same expectations of your child. Mm-hmm. You can talk about it.
Right.
That this is hard, and it's harder than it normally is. And it is, but it's something that you can get through. But I don't know that you should necessarily give them a break.
Right.
But you try to keep moving on.
Now, what about that older teenage son who is refusing therapy?
Yeah, so on the more extreme side, if a child is not willing to engage in therapy, it really depends, again, on what is the intensity and how ongoing is this. If there's a concern that this child is suicidal and that potentially suicide is imminent, a parent does have the right to have their child hospitalized involuntarily.
Right.
You are the guardian. You can make that choice for your child against their will. And that's okay to do. And you actually should do that. And it's the same, I come to the same situation when I'm dealing with an adult who tells me I'm suicidal, I'm going to kill myself, and I don't want to be hospitalized. I call 911 and I send them out or have them picked up because I have a responsibility to make sure someone is safe. And, I think that a parent has that same ability to do that. It's really interesting because some kids who are hospitalized, who are suicidal, it can be very eye-opening for them. Sometimes it can be really life-changing for them to go to the hospital and see some other youth who have some major problems.
Right.
And that can be like, wow, okay, things could be worse. Yes. And sometimes that in and of itself can be a negative enough experience, but helpful for them to see things in a different way. So, the other side, though, is challenging because to force a child to do therapy who doesn't want to do therapy, I've seen a lot of adults who did therapy as a child and didn't want to, and they tell me, I didn't want to do it, and it didn't help me. So that's a challenging thing. And I will say, though, even as a psychiatrist and even being in the mental health field, seeing a therapist or seeing a psychiatrist is not the only way. And I think we pursue all options that are available, whether it be helping the child to engage in church activities,
right, or
social activities or family activities, even trying to spend time with the child. But I think the big key there is the concern. If there's a lot of withdrawal, something needs to be implemented to bring them out of withdrawal. Whether it's more the standard techniques of the lighter side, just to summarize, is more implementing just normal rules and regulations. A little bit deeper is going to be have them engage in some way with church, social, family, therapy. And at the deepest level is forcing them to be hospitalized if it's that extreme. Right. And obviously you don't want to be forcing your child to be hospitalized every month because they're not doing what you tell them to do. But it's
right.
But it is a last resort measure if there's concern. Yeah.
Well, thank you so much.
Yeah.
That's all the questions that I have today. But I have really learned a lot, and we both hope, especially that if you've been listening through this, that you find some hope in this, and that you can find some direction for whatever your situation is. So thank you so much, and thank you for listening. And like I always say, make it a great day, and we'll see you on the next episode. Bye.